This is new, but like Miss Ashley said, if y'all have questions, jump right in. Happy to answer those as we go. So we're going to talk about gastric ulcers tonight, and I call this fact or fiction. I want to talk about the facts behind gastric ulcers. Everything tonight came from one or two sources. One was from Vet Clinics in North America. It's where they summarize all the current information into easy to read articles. So everything came from either that publication or the European College of Internal Medicine. They published a consensus statement. I think this was done in 2015. So everything you're going to hear tonight is going to come directly from one of those sources. This isn't what I think, what I feel. This is what we call facts. This is as close as we have to pure facts on this topic. So, So like Ms. Ashley said, I am Dan with the Countryside. My practice is in Covington, Georgia. We do a variety of things. Predominantly myself, I do sports medicine. So that's what got me into stomach ulcers, because this is a big problem in sport horses. So, and that's why we're here tonight. So when we look at this, 40 to 90% of performance horses have some type of ulcers. Anytime you see EGUS, that stands for Equine Gastric Ulcer Syndrome. So when you think about that, if you have a horse, and this is regardless of discipline, this is barrel horses, these are hunter jumpers, dressage horses, reiners, you name a discipline, 40 to 90% of these horses are dealing with some form of gastric ulcers. It's actually the number 2 cause of poor performance in sport horses. It had to take the place of respiratory disease. So the number 2 cause. The other reason I want to talk about this is when you go onto Google, you can read anything and everything. And I just kind of want to set the record straight. This is what we know. This is what we know works. So if you're going to understand gastric ulcers, you've got to first know the anatomy of the stomach. Can y'all see my pointer up there? I hope y'all can.
Yes, we can. Yep.
Okay. So this is a gastroscope. What we're looking at in this view is looking down on top of the stomach. This is an empty stomach. You'll see where the scope is actually coming in the stomach. That's the cardiac sphincter, the esophageal sphincter. You're going to look right under this rim is where the pylorus is located. The pylorus is the outflow of the stomach in the small intestine. That's what you're seeing right over here. This is the pylorus. This is going to come back into play. This is an important thing to remember. We also have, when we look at the anatomy, we have 2 portions of the stomach that we're going to talk about. One is the non-glandular stomach or non-glandular mucosa. This is the same tissue that makes up the esophagus. When we get to here, this is the glandular portion of the stomach. This is where we're actually going to make all those acids and enzymes that are located in the stomach. The junction, when you look at these yellow lines coming through, it's called the margo plicatus. This is a very, very common site for stomach ulcers. So those are the few things you know about the anatomy of it and where everything's located. So the physiology, how does the stomach work? So the stomach's main role is in digestion. It's going to help us digest feeds. It's going to help us digest forages as well. It's going to do that through a few things. One is hydrochloric acid. So that's the acid made in the stomach to help break things down. To give you an idea, hydrochloric acid has a pH of 2. That's about the same pH that's in your car battery. It's very, very acidic. We also have a few other things. One of them is pepsin. This is an enzyme that breaks down proteins. It's secreted in the stomach. And we also get some influx of bile acids from the pylorus into the stomach as well. So hydrochloric acid, when it's made in the stomach, you got to go through this big pathway. And just to keep it simple, this little guy called a proton pump lives right here. Its job is to pump hydrogen ions into the stomach and pull potassium out. So the whole role of this proton pump, keep pumping those protons, little H pluses. The more H pluses you have, the more acidic you get, okay? The chlorine comes from another pump, and that's where we get hydrochloric acid. So that's how That's how the stomach works. This is all done down in that glandular portion of the stomach that we talked about in the last slide. That's where all this is created. This is going to come back into play later on. So, clinical signs. When might you be dealing with gastric ulcers? What should you look for? I will tell y'all, there's nothing more vague than the clinical signs for gastric ulcers. You hear everything. Inappetence is one. Weight loss. Some horses have chronic diarrhea. Chronic colic. I'll tell y'all, the number one that I see in my practice is changes in behavior. Moody mares, grumpy geldings. Okay, that's the two horses I scope more than anything. In our practice, we're going to scope over 100 horses a year. We do a lot of this, and I'd probably say 90% of them, we're looking here at these changes in behavior. So keep that in mind. Maybe that mare that you think's really moody, maybe she's not hormonal. Maybe she's got stomach ulcers. The reason for this is it's a chronic source of pain. It's chronic pain. These horses hurt. If any of you've ever dealt with chronic pain, you understand after a while you get grumpy, and these horses will do the same thing. So keep that in mind. Some of the other things that people will talk about are over here, these types of behaviors where they're really girthy when you pull the saddle, cribbing, weaving, different stall behaviors. These are some other signs that we often look at. And one of the things I'll tell you is severity of clinical signs does not correlate with severity of disease. There's often times that we'll look at these horses and we get in the stomach and they've only got maybe a grade 1 gastritis in the stomach. But when we get them treated, the behavior decreases markedly. So just because the horse is acting really angry doesn't mean they have really bad ulcers. It just means they're hurting and they want some relief. So those are a few of the things you'll be able to recognize, but the one I really, really talk to people a lot about, these changes in behavior, that's something that occurs way more than we realize. So risk factors. What puts your horse at risk? Long periods without forage. Empty stomachs. One of the things we'll actually utilize to study gastric ulcers is a fasting model. We'll fast these horses for 48 to 72 hours, and we can induce ulcers just by taking them off of feed for long periods of time. Horses that are in stalls have a greater propensity for stomach ulcers. Another big area is the use of different anti-inflammatories. These are NSAIDs. This is bute, banamine, equiox, different steroids like dexamethasone and prednisolone. When horses are on these medications, this greatly increases our risk of developing stomach ulcers. Intense periods of exercise, trailering, traveling, concentrated electrolytes. These are those, when you're worried about your horse not getting electrolytes, you give them that big tube of electrolyte paste. You want to be cautious about that, and we'll go into it. So when you look at these risk factors, it's understandable why performance horses are more likely to develop stomach ulcers. If you think about it, when you look at these performance horses, most of them live in these conditions. They're in stalls. They're in intense exercise when they're training. They're constantly traveling, trailering to shows. During the summertime, a lot of them do get some type of an electrolyte. Their own bute, banamine, equiox is needed. So, these horses are really at risk for this. This is one I want to talk about as well, because this is part owning a horse. If you have a performance horse, you're going to have injuries. We're going to use these medications, things like bute and banamine. Now, one-time use isn't going to be an issue. It's when we're on them chronically. One of them I like to talk about too is equiox. I hear this a lot. Horses are on equiox. It doesn't cause stomach ulcers. This is where I want to point to this keyword over here. It's less likely. Chronic use of equiox, you still do have some risk of developing a stomach ulcer. This is through a pathway that decreases blood flow into the stomach to the gastric mucosa. If you look here, equiox is what we call a COX-2 inhibitor. So the enzyme is cyclooxygenase 2, but it does still have an effect on cyclooxygenase 1. That particular enzyme is responsible for blood flow to the stomach and is also responsible for the production of mucus that helps to protect that stomach from the acid. So that's just one thing I want to make sure we bring up is just because you're using Equiox does not take the risk away from gastric ulcers. Now, I will tell you it greatly decreases your risk of it, so don't group it in with butanvatamine as far as this stuff's bad too. But just know that just because you're using Equiox doesn't mean you're not going to get a stomach ulcer and you're lower risk. Steroids, dexamethasone and prednisolone, they're going to follow that same pathway as the others. So these particular medications, they're not completely harmless when we give them. They do have risk. So how do you diagnose stomach ulcers? So I get asked this question a lot. What's the best way to diagnose this? The best way is through a gastroscope. Anymore, this used to be a big deal. You got to bring your horse into the clinic. So you're fastening them, you're putting them on a trailer, you're having to bring them in. Here at our practice, we have this particular setup, which is a wireless endoscope. This allows us, it actually, if you look right here, that's an iPad, and we can actually see the images on the iPad. So this scope goes where we go. It's been halfway around the world with me a couple times. It's been all over the country. It goes where we go. So it's not as difficult as it used to be. There is a product on the market, Succeed. It's a fecal blood test. The thought there was it could pick up blood in the feces to give us an idea if there were possible stomach ulcers. And again, this is not my opinion. This is reading the science here. It's just not very accurate. What we found is better at monitoring inflammation in the colon. As far as its ability to diagnose stomach ulcers, it's really not all that accurate. So if you're concerned about it and you're going to understand why, then the thing to do is a gastroscope, where we actually go in and physically look at the stomach. That's really that's actually is the only way to diagnose it. A gastroscope is not a difficult procedure. It's a pretty long scope. It's about we've got one scope here that's a 3 meter, other one's a 3.5 meter. That's, 4 feet to a meter. So you're looking, 12 to 15 feet of scope. Most importantly, your horse does have to be fasted. We have to have an empty stomach. We're going to pass the scope in there. We're actually going to inflate the stomach. Once we inflate it, we're able to look around and see what is going on. Typical schedule for us is we remove all feed and hay at 6 p.m. We're going to do the scope the next morning at 9. That's usually more than enough time. Also, that short of a period of time without feed, you're not going to induce an ulcer in your horse. If we find one there, it was there beforehand. You can look on the screen. This is an image from inside of a gastroscope. We're looking at that glandular mucosa down here, Margo plicatus right here. And you can see the ulcerations in this mucosa. This is more normal stomach. And now we're looking at abnormal stomach, I'd probably call this a grade 1 gastritis. But these are things we're able to see. Now, why is a gastroscope important? I think my horse has ulcers. Shouldn't I just treat? Well, not all ulcers are created equally. Plus, the severity and grades may determine how long we need to treat. I wish all ulcers cleared up in 30 days of treatment, but not all of them do. If you look over here, this is a small grade 1, maybe a grade 2 ulceration in the non-glandular mucosa. High probability this one's going to heal up fairly quickly in 30 days of treatment. When you look here, this is about as severe as it gets, that you can actually see blood dripping out of this ulcer. This is pretty severe. Hopefully y'all never experience this one. This was actually a horse that was on chronic NSAID use for ocular pain. The horse had uveitis on chronic banamine to control it, and this is what we found in his stomach. If y'all remember our normal pylorus that we had in another picture, this is an abnormal pylorus. This is a pyloric ulcer. These, Lord help us. I mean, they're just difficult to treat. We don't fully understand what we're dealing with on these as far as what causes them. We've got a few ideas on how to treat, but they're not, they're by far not the easiest ones to treat. I think I've been working on one now for, I think 15 months, trying to get it corrected, but this is a pyloric ulcer. So knowing what you're dealing with is critical, because then we can gauge how long the treatment needs to last, what our treatment needs to be. We're going to treat a pyloric ulcer, a grade 4 ulcer, or grade 5 even, and a grade 1. We're going to treat these differently. We're going to reach for different medications. All right. So you guess and you're not sure, you're going to throw a lot of money away without knowing what you're doing.
So Dr. Carter, I had my mare scoped, and she was a grade 2 non-granular. She had ulcers in the non-granular part. So
grade 2 non-glandular.
Yep.
You should be good on 30 days.
Yeah.
One of the things I tell people is, even once you start treating, and we'll talk about how the treatment works, you still have a wound here in the stomach. You still have a wound. So once you treat the underlying cause of the ulcer, you still have to heal this wound. We have to heal that wound. So that's very, very, very critical. So that's why also one of the things, like where that came from, is me and Miss Ashley were talking out before this, and I always recommend and really tell people we need to do a follow-up scope. The reason we need to have these follow-up scopes is because if we don't heal these ulcers to completion and we stop treatment, they're coming right back. Because until that mucosa, until this area here looks like this, as soon as you stop treatment, it's coming back. It's like treating a wound partially. It's going to keep coming back. So treating these stomachs to completion is critical. So that's why, and when we look at these, if you've got a severe, like, I mean, obviously this horse over here, we're not rechecking that one in 30 days. We're not going to win this game in 30 days. We're going to be pushing out closer to 60, and then we're going to do a follow-up scope then, and because we want to make sure we treat them all the way. So the other thing is making sure you're actually dealing with the stomach ulcer. These are 2 cases that came in. These are bots. Y'all seen those little yellow eggs on your horse's legs? This is what they look like in the stomach. This particular horse, because if you have a few of these, it's not a problem. But when the entire non-glandular mucosa is covered in these guys, we got an issue. So in this case, we put a scope in, we see this. We don't prescribe Gastrogard. We prescribe a tube of $8 ivermectin, and we solve this horse's problem. So $1,000 for Gastrogard or an 8-bottle tube of ivermectin. Your scope just helped make that decision. Now, this isn't terribly common. The other thing we found is this horse over here had what's called a phytobezar. It is a ball of material that gathers in the stomach. It gets compressed together, and it doesn't digest, it doesn't break down. So it actually causes an outflow obstruction in the stomach. This is a chronic colic horse, been, just off and on colicky for 2 or 3 days. We couldn't find anything else. We decided to pass the scope. We go on the scope, and lo and behold, we have this big ball of tissue, or a big ball of hay, grass, whatever else is in there. Interesting enough, you treat these with Coca-Cola. You actually put Coca-Cola in there, and the acid from the Coca-Cola actually helps break these down. So he got a couple of liters of Coke, rechecked him the following day, and we'd actually broken this up and got out of the stomach. So kids, Coca-Cola actually has medicinal purposes. So that's a couple cool things you find on gastroscopy. You can also use it to find your keys if you drop them in your truck. There's a lot of things you can use a gastroscope for. Treatment. This is always the one, okay? So when we get into treatment, there's a couple different options. I'm sure y'all have all heard of Gastrogard, which is a omeprazole. We'll talk about that in a little more detail. There's another medication called ranitidine that we use sometimes. I'll be honest, ranitidine doesn't work as well, and you've got to give it 3 times a day, 3 to 4 times a day to truly be effective. And your length of treatment is quite long, 60 to 90 days minimum. So we don't use a lot of it. There's another medication, sucralfate. If you have a really deep ulcer, what sucralfate does, it goes in and basically puts a Band-Aid over the top of the ulcer. So if you've got one that's actively bleeding or really deep, you want to use this to protect that tissue from the gastric acid. A newer medication is this Gastrozole. It's known as pantoprazole. It's kind of a next generation of the omeprazoles. It's showing a lot of promise. The issue is it's not available in the U.S., so we haven't really gotten to use it. There's another medication, misoprostol. If we're dealing with ulcers in the glandular portion of the stomach, especially the pylorus, we're going to reach for misoprostol. That's going to be a twice-a-day medication. Like I said, if it's a pyloric ulcer, that's one of the ones we're going to get. You hear a lot about antacids and buffers. There's going to be a lot of supplements on the market that talk about buffering the acid in the stomach. Here's the downside. In people, when we eat a meal, our body begins to produce these enzymes and produce this gastric acid. In horses, it's steady rate production. It's 24 hours a day, 7 days a week. It's continuous. It never stops. So if you put a buffer in there, it's a temporary fix. Like I said, most of them are going to be less than 2 hours. So the buffers just don't do what we need them to do. So let's talk a little bit about Gastrogard. Gastrogard is omeprazole. Now the magic of Gastrogard is not an omeprazole. The magic is it's protected. Is how it protects the omeprazole. What you run into is omeprazole itself actually is completely destroyed in an acidic environment. So if it hits acid, this molecule is destroyed. If it's destroyed, it doesn't work. So if you look at human medications such as Zantac and different ones of those, we talk about the candy shell that's on there. That's that enteric coating, the candy shell. The candy shell gets that tablet through the stomach. Once it reaches the small intestine, it's able to be broken down there. Once it's broken down that neutral pH, it's able to be absorbed through the small intestine, catch a ride on the bloodstream, and it comes back. Remember this little proton pump over here? Once it gets back to the proton pump, it irreversibly binds this and shuts it off. So once it binds there, it stops pumping the hydrogen ions into the stomach. So when we look at Gastrogard, what they were able to do is figure out how to protect the omeprazole so it will survive the stomach, get into that small intestine, feed back and work. A lot of people want to use the compounded omeprazoles, and guys, I don't have a dog in this fight as far as it. I don't work for the company, so I'm just telling you straight here. The compounded omeprazoles, they're not going to cut it. You can read countless papers; they just do not reach therapeutic levels. They don't work, and the main reason is it just does not survive. It doesn't survive the acidic environment of the stomach, make it through and get absorbed. So I can tell you, one of my great mentors, he always said the same thing: the most expensive medication is the one that doesn't work. So I would tell you to stay away from that product. I hate it. Stick with the Gastrogard. I can promise you it does work. So a little bit on treatment there. So let's talk about, we're going to kind of get into prevention. How do we prevent these stomach ulcers? What can we do? And we're going to talk about that through a lot of different management strategies tonight. So, because I think everyone would agree, we'd much rather prevent a stomach ulcer than have to go treat one. One is going to cause our horse pain, and second, it's going to cause our pocketbook pain when we got to treat them. So let's figure out ways we can manage them. One of the most important things that we see is time between feedings. When I talk about these horses constantly producing the same amount of stomach acid constantly, That's because they're made to be grazing. Horses are made to be eating 23 to 24 hours, or 20 to 23 hours a day. I mean, they walk around and eat all day. When we start putting them into stalls, we start putting them in performance situations. One of the first things we do is they become meal eaters. We're going to feed them in the morning, feed them at night. We're going to throw hay to them twice a day, sometimes 3 times a day. That time between feedings is critical. You want these horses continuously eating if you can. So the longer you wait in between feedings, just like I told you, if we want to study gastric ulcers, the first thing we do is hold them off feed for extreme periods of time. Like I said, that 2 to 3 days will hold them off feed. Water. When I was a nutritionist, I tell people all the time, water is the greatest nutrient we have. It's the most important nutrient we have. We always forget about it. Horses without access to water, again, they're 2.5 more times to develop a stomach ulcer than horses that have free choice access. So good, clean water is going to save you in so many different ways. This just happens to be one of them. Concentrate versus roughage diets. There's times when hay gets scarce or hay gets scarce. We want to make it up in more concentrated feeds. We want to feed more grain and less hay. That's not how horses are designed. That's not how they're built to work. So you want to watch that ratio. What we tell people is you want to have that grain in excess of 1% of body weight. So horses can eat about 2.5, sometimes 3% of body weight a day. And you only want 1% of that body weight. So average 1,000-pound horse, you want to try to stay under that 10 pounds of grain a day. I think a scoop is 3 pounds. By Ashley, I think it's 3 pounds.
Yeah, roughly, depending on what you're feeding.
Okay.
Yep.
I tell everybody, if you really want to know how much you're feeding, get a scale. They're cheap, and weigh it.
That's the best, most accurate way, for sure.
So if you think about it, if you're feeding 2 scoops twice a day, 3 pounds of feeding, you're already crossing over that threshold. We know those horses have an increased risk of ulcers. One of the reasons is you do have bacteria, and we're going to talk about those momentarily. You do have bacteria in the stomach. You're going to get fermentation of those feeds in the stomach. And one of the things you're going to produce is what's called a VFA, or a volatile fatty acid. Great in cows. That's what cows depend on with the rumens. Bad in the stomach of horses because, again, we're decreasing that pH. So watch how much grain you're feeding. One of the things that really helps, as you're fixing to see, is high-quality hay. I was a nutritionist before I was a farrier, before I was a vet. So forage is a big deal to me. High-quality forage is very important for horses. One of the things we say is, one of the things that we've seen is feeding alfalfa hay resulted in higher gastric pHs. So the more alfalfa these horses are on, the higher that pH, the less acidic it is, and the happier that stomach is. Also, when you're feeding higher quality, something like an alfalfa hay, that's going to decrease your need for concentrates in the diet because you're going to be putting more of those good calories into the horse. You're putting more of that protein in the horse through a forage source, not from a grain source. It does increase your cost on your horse to have to feed a higher quality hay, but you're going to pick up a lot of that savings by not having to feed as much concentrate. We're still trying to figure the exact mechanism behind how alfalfa hay does decrease our risk of stomach ulcers. The current thought is there's a form of calcium. Alfalfa hay is high in calcium, and one of the form of calcium that's in is calcium carbonate. Calcium carbonate is what's in Tums, so it does act as a buffer. We think that's one of the mechanisms behind it. So quality hay. Intermittent fasting, I think that's the new diet trend that's going on, but intermittent fasting when horses are held off feed for periods throughout the day. So if you feed in the morning, you don't feed again until you get home at night. They don't have anything while they're in their stall, while they're in their paddock. That's going to increase that risk. Another one, hypertonic electrolytes. So it's summertime, you're worried about your horse sweat, and you got that big old tube of electrolytes. You've got to be careful when you're putting that into your horse. Those hypertonic electrolytes can really cause an issue. So we're going to talk about better ways of getting those electrolytes into horses as well. So those are a few things from the feed side we need to pay attention to. So what can we do from a management aspect? Free choice access to pasture hay. The absolute best thing is if you can have these horses turned out as much as possible. Have them turned out on pasture. They're moving around. This is a more normal environment. They're grazing as they go through the day. I know that's not always the option, especially in the performance world. That's just not an option that we have. So one of the things I highly recommend, these are slow feed hay nets. Some of these will hold up to a bale of hay. Keep these in your horse's stall. I can decrease the number of horses with gastric ulcers in a barn just by the addition of slow feed hay nets. A lot of times we put these in here. It doesn't have to be the greatest quality hay, just something so they're constantly eating. And it may be in there for days or weeks, depending on how much hay you put in. So you can still feed your regular amount of hay on the ground, but keep one of these in so they can constantly nibble. One of the things that this also helps with, or the way this works, is horses' saliva actually have buffers in. They actually have buffers in their saliva. So every time they swallow, they're helping to buffer some of that stomach acid. Also, keeping that hay in the stomach. If you remember that picture from earlier, we had a lot of liquid in the stomach, and that's acid. If that stomach's empty, it's sloshing around. So by keeping that grass mat in there, we're preventing that acid from sloshing around, and we're also neutralizing that acid, getting a higher pH. Free choice access to water. Don't limit their water intake. I mean, keep as much water as you can in there. Back to, should have mentioned this, back to the free choice access to pasture hay. When your horse is getting ready to work, make sure try to do everything you can to make sure they have that full stomach to where they have that hay in them. You think about, you're riding around, if you got a lot of liquid in the stomach, it's going to continue to slosh. It's going to slosh up on that non-glandular mucosa, and you're going to have more risk of damage to that mucosa. So again, keep the stomach full. Access to water, you saw right there, you decrease your risk of ulcers 2.5 times just by making sure they've got water everywhere they go. They're not limited to water. Smaller grain meals. Okay, we want to try to keep it under 1% of body weight. So like I said, under 10 pounds, but it's still not a great idea to go out and feed 9 pounds of grain at one time. So you want to break those up into multiple feedings. If you are in that 9-pound category, try to break it up into two or three feedings. I know some of these horses, they need more. So break it up into 2 or 3 feedings throughout the day, and that would help decrease your risk as well. Whole grains. Well, one of the things we've seen in studies is the whole grains, because of the way they're digested, have a lower risk as well of stomach ulcers. What I mean by that is if you look at a lot of pelleted rations, we're taking those rations, we're grinding them and putting them into pellet form and then feeding it to the horses. By feeding more of the whole grains, we're able to decrease some of that fermentation that happens in the stomach and able to move them through with less alteration of pH to the stomach. Again, alfalfa hay, I can't encourage this enough. Having some alfalfa hay in the diet. One of the questions I get asked a lot is, can I feed an alfalfa pellet? Can I feed an alfalfa cube? It's better than nothing, but they're not a replacement for alfalfa hay. A lot of the, especially in the pellets, when you're making that pellet, a lot of that calcium carbonate is lost in the pelleting process. Same thing with the cubes. A lot is going to be lost there. Also, the cubes, we typically make an alfalfa cube out of a lower quality alfalfa than a true alfalfa hay. So I would tell you if you can, stick with alfalfa hay. If that's not an option, then pellets and cubes are better than nothing. So this is kind of a new topic, or not a new topic, but a much debated topic in veterinary medicine now is looking at the use of probiotics. These are some of the probiotics that have been shown to be beneficial. Again, we're altering the microbial population of the stomach. Saccharomyces, there's been a lot of work with Saccharomyces, different species over the years, over the last couple of years, on what it does in the GI tract. These organisms are all listed to say that all these have been listed to or been shown to help with the reduction of stomach ulcers, these different probiotics. There's still a lot of work to be done here. I wouldn't say this is going to be the cure-all, but I think we are showing some benefit. I was not a big probiotic fan for a lot of years, and here recently seeing some of the work that's come out, I'm starting to believe more and more in these probiotics, especially Saccharomyces. The more we learn about this particular species, I think it's a yeast actually. The more we learn about it, the more realizing that it does have a lot of benefits. I think even some feed companies are starting to incorporate it into their feed. So I think you're going to see more and more about probiotics, but I do think probiotics that have these particular bacteria in them are definitely good to have.
Which that's good to hear, because I do have my horses on a supplement. I don't know what it's called, but it's supposed to balance the pH in their stomach and also, or help balance the pH, and also it has probiotics added to it. So I'm going to definitely check and make sure it has those in it.
Yep, check and see. It's probably Saccharomyces is the one that's getting most common right now. So I think it's probably, and there's more species of Saccharomyces. And don't ask me how to pronounce that one or really any of those others, because I can't. So, but most of these Saccharomyces species are beneficial. Pharmaceutical assistance. All right. Certain situations we're going to need some we're going to need some pharmaceutical help. I tell everyone, and I'd probably say 99% of my show horses, they jump on a trailer, we're following this protocol. We're going to use GastroGuard or UlcerGuard. We're going to use a 1 mg per kg dose. So GastroGuard, you're looking about a quarter tube. And you're going to do that before traveling and when you're going to show. So our protocol is you're going to start the day prior to traveling. You're going to keep it through the time you're at the show, and then 2 days once you get home. The good thing about that, most shows you're looking at maybe 1-2 tubes. So it's really pretty cost effective when you look at it, because I think most people would agree they'd rather give 1 tube when they go to the show than end up having to buy 30 after 3 shows, because they ended up with a horse with ulcers. So this is a real simple thing to do. And I've seen this help a lot on these horses. So reach for that GastroGuard or UlcerGuard, put them on that preventative dose, that 1 mg per kg, talk to your veterinarian about a good dosage. And this will help a lot. I tell people, even if you're just trailering somewhere, let's say you're putting your horse on the trailer and it's just going someplace to, let's say you've got a horse you're loading up to go take a lesson, give them a quarter tube before you go. I mean, it's worth it. Also, if you're using any kind of an NSAID or a steroid, so let's say you've got a lameness issue, you're having to use bute or you're having to use Banamine, throw them on that 1 mg per kg dose of GastroGuard or UlcerGuard. Be proactive here. I guess that's my biggest thing, is be proactive. If you think this is going to be an issue, be proactive. One of the things that we do in our hospital here is anytime a horse comes in and is going to be hospitalized if it's going to spend the night here, just one night, it goes on a quarter tube of GastroGuard, period. We don't give an option on this. This is just what we do. That is part of the program at our hospital. Your horse comes in, spends the night, it's getting a quarter tube of GastroGuard. These horses do so much better. I used to have a big issue with horses coming in. I've worked at several big equine hospitals. I used to actually work for Reardon Riddle in Lexington, Kentucky. And we're talking about horses that would even come in there. These horses are constantly on the road. You'd see them and they just don't do as well in the hospital. When they go home, they're down for a few days. And what I found was when we started doing this quarter tube while they were in our hospital, they didn't have that slump where they didn't want to eat. They went home and they felt just as good when they got home as they did when they came in. Because we get a lot of calls saying, hey, he just doesn't feel good. He's just not himself. Well, those calls went away when we started adding this to our regimen. So hospitalization, absolutely add that quarter tube in. Help those guys out. That's a risk factor. Let's do all we can to prevent that. Let's be proactive. Again, when you're using when you're treating that foot abscess, ask your veterinarian for a tube of Gastrogard to have them on that lower to decrease that risk. Because like I said, if we can decrease that risk, that's a lot better than having to treat. I always mess this up. What's that thing? An ounce of prevention is worth a pound of cure or something. Like just keep it at bay. So that's kind of the pharmaceutical way of dealing with these. With that, I'll take some questions, but I would tell the most important things that if I had to give you any takeaways from today, one, if you suspect ulcers, get a gastroscope done so you know what you're doing, you know what you're treating. Once you start treating, have those follow-up scopes to make sure you go to completion. 2, use the right medication. The gastroscope is going to tell you what medication you need to use. 3, do things, small, simple things to prevent this from being a problem. Y'all saw the stats, 40 to 90%, and that just depends on which publication you read. We're scoping 100 of these a year, and I would say that out of 100 horses, most horses I'm scoping, they're performance horses, dressage horses, reiners, hunter jumpers. Most of them have it. We treat a lot of horses for this. So we can work on things management-wise to prevent this. Like I said, as much time out as we can get. When that's not possible, that slow feed hay net, using things like alfalfa hay, watching our diets and how we feed, because that's the thing I'll tell you. If you want to reduce the amount of concentrate in your diet, feed a better quality forage. You feed a high-quality forage, your need for that concentrate will greatly decrease. I tell everybody, if you want to know the place to not save money, that's on forage. Like, spend money on forage. Get the best forage you possibly can. That's what your horse is meant to eat. In the long run, it's going to save you. So decrease the amount of concentrate we're feeding, using that high-quality forage, grazing, winter grazing pastures. I guess here's my plug for the extension service. If you want to know about winter grazing, call your extension agent. These are the greatest people in the world. They'll tell you how to put in that winter grazing. They're going to tell you how to get the rye in so that you've got that pasture year-round. Your horse is out grazing, doing what the good Lord made him to do. So get that done. When you're going to be traveling, things like hay nets in the trailer, you got a long trip, put a hay net in the trailer. This is cheap. This is easy. Hang it up there. Let them eat while they're driving. We've all been on an airplane, and we know that bag of peanuts and that, well, I was flying the other day. They don't give you a bag of peanuts anymore, but you see, you got a bag of peanuts and a cup of coffee, and it made the trip better. So give your horse a bag of peanuts. But with that, I'll finally be quiet. If y'all got questions, I'm happy to answer all I can.
Yeah, thank you, Dr. Carter. Definitely we have an equine newsletter that goes out to several different counties in North Georgia. And I will say that our next issue will focus on traveling and trailering your horses, kind of gearing up for that show season coming up next spring. So we're definitely going to talk about having hay and feed in your trailer and potentially the use of electrolytes. So I'm glad you covered that in your talk today. And if anybody has questions about nutrition, our previous one was on nutrition. Our previous equine webinar was on nutrition. So you can go back and find the recording for that in case you missed it. We'll be glad to answer any questions that you have.
Can I say one more thing about electrolytes?
Yeah.
So when I talk about feeding electrolytes, I'm not saying don't feed them. And I meant to mention this earlier. When you do feed that electrolyte, include it with a meal. So put these on grain or feed it with grain so it's not just a pure salt sitting in the stomach. When I was, like a long time ago, I was an athlete at one point in time, believe it or not. We've all seen the horses used to be athletes too. We all change. We used to have to eat salt tablets. Like our coach would give us salt tablets. And so we'd take this big old handful of salt and we'd eat it because we had to replenish those electrolytes. I can promise you, your stomach hurts from a big old salt tablet. It don't feel good. So when you're using electrolytes, just use them wisely. Mix them with a grain meal. Make sure there's something else in the stomach so that that's broken up. So I'm sorry I didn't cover that. Thank you.
Katie, did you have a question?
Yes, I did. Thank you. I guess first of all, thank you very much. And then thank you for your dosing guidelines for feeding Ulcer Guard when traveling. I have been doing that, but I only was doing it the day we left and while we were at shows, not before or after. And then question, in your opinion, are any of the ulcer supplements, the cure-all things besides Ulcer Guard, GastroGuard, are they worth it for any dose of prevention at all?
Most of the ones out there are going to be buffer based. So they're looking at buffering the acid in the stomach. Like I said, the problem with buffers are very short lived. We're talking about less than 2 hours in most cases. I don't want to say they're useless, but we don't have a lot of data behind them saying they work. And this is the hardest thing in the world to actually study, is how to prevent an ulcer. Because if you think about it, you give a product to 20 horses and 80% of them don't develop an ulcer. Well, we're 80% of them just not going to do it anyway. So it's one of the most difficult things to test. Again, science-wise, don't have a lot of studies on these. So like I said, when it comes, that was one thing I wanted to keep out of tonight is my opinion. I want to tell you what all the nerds say. Like I always tell people, I'm going to go read what the nerds say, and that's what I'm going to relay to people. There's smarter people than me out there figuring this out. But I would say from the ones I've seen, I guess I made this short question way too long. The ones I've seen, they're working off of a buffering system. And like I said, that's going to be less than 2 hours. So I doubt any of us are giving them enough to truly make a difference.
Well, okay. So kind of to tie into that, you know, there's the Abler products, I think that's what it's called. And they're omeprazole based, but I don't know if it's the correct dosage. And even if they have enough coating to get to that small intestine, to get through the stomach. So have you heard of the Abler products?
I have, and there's actually there's a paper published. I meant to pull that up, but they ran a trial, so we can actually go through and give different medications to horses, and then we can look at therapeutic levels. Did they reach a therapeutic level of omeprazole in the blood just by pulling a blood sample? We'll do them time-based. Maybe give something orally, start pulling them at 30 minutes, and then continue to pull for several hours, and look to see if the compound does reach a therapeutic level. The Abler pellets were put through that, and they did not reach a therapeutic level. So there's more to candy shells than just getting it through the stomach. It's got to, get through the stomach, let it survive. 2, the candy shell's got to come off. So if the candy shell doesn't come off, then it's just going to pass right through the GI tract. If this stuff gets to the colon, the microbial population there's going to chew it up and make, I don't know what out of it, just make something else. And it's not going to get absorbed. So that's the tough part on the Ablers is, okay, we give them, and let's say our candy shell does survive, but does it come off in time before it gets to the large colon?
Gotcha.
And that's what we don't know. I can tell you I've scoped a ton of horses that have been on Abler pellets and are little, I call them pop rocks, have been on little Abler pop rock thingies, and we're still fighting that problem.
Yeah, okay.
There's
another question in the chat box from Ashley. She says, I have a yearling TB colt who had colic surgery in May, and they found ulcers after the surgery. He was treated with GastroGuard and sucralfate. But what are your thoughts on supplement U7 to prevent future ulcers?
What's the name of the supplement?
She said U7.
U7. Again, that's the tough part on these supplements. We don't have a lot of science behind them. And so it's hard for me to say one way or the other. This is something I tell people all the time, and I'm not downplaying any supplement on the market. Please don't think I'm doing that. But what's required for a product to get through? Let's say if we're sending a medication through, not only do we have to prove safety, but we got to prove efficacy. We got to prove it actually works. When you get into supplements, which is into the nutraceutical world, I just got to prove it's not going to kill your horse. So I can grind up some grass, call it Dr. Dan's magic ulcer elixir if I want, prove that it won't hurt your horse. I can write whatever I want to on there, sell it, and it's legit. So that's always the tough part when we get into supplements is the data there, and is it true data? Okay. A lot of times we look at data, and that's always the thing I tell people to be cautious about. When you're looking at data, you're looking at studies. If it's, I did this and it worked, it's not real great science. You want something to where we're actively evaluating this. And so I say that about different supplements. And I'm not saying they don't work. I just can't tell you they do. So that's one thing I would just say is it's difficult to say what does and what doesn't work.
And I mean, a lot of times if you're feeding those supplements, you may be, increasing the times that you're feeding, or you have maybe changed something else as well. So I know people say, oh, I tried this supplement and it worked. But I also added alfalfa hay, and I also, added this and that. And so
I tell people this all the time. Again, I was a couple careers ago, I've trouble with jobs. I was a nutritionist, and I tell people all the time, if you'll take everything you're spending on supplements and let's focus on good quality nutrition. If you want to know the supplement that we got some science behind that works, and that's good alfalfa hay. So take what you're spending on a supplement and put it into a quality forage, into a quality feed. Like I said, a lot of times you get on a good quality forage, your need for feed greatly decreases. So alfalfa is going to be the supplement I know that's proven to work. So
okay, so we're kind of on the topic of supplements, and I mentioned this before we started. GastroGuard, or not GastroGuard, but the Purina Outlast, and not like plugging any product or specific supplement, but I do know that there are a couple studies out there with the Purina Outlast that have shown, equal success to supplementing with alfalfa.
Mm-hmm. I should have read more up on those. I have seen some initial data, and I'll be honest, I've just looked at the graphs, so I don't want to speak too greatly. But with the Outlast, there is, again, it's working more off of a buffer system, and they've got a slow release buffer in that feed. So from that standpoint, it's going to work. Because again, we think the trick behind alfalfa is a slow release buffer of calcium carbonate.
Yeah.
So as long as that alfalfa is in the stomach, we're getting that slow release of calcium carbonate, which is the Tums. And don't quote me on this, but I think that's how the Outlast is working.
Yeah.
Is a slow release buffer. Is that correct?
Yeah, it's very similar. Yep. And it's very alfalfa based. Okay, so one thing, feeding alfalfa cubes versus whole alfalfa hay, is there any difference in studies there?
Don't have a ton of studies, but I can just tell you from a processing standpoint, again, if we're looking at it from a calcium carbonate perspective, the way you make pellets and hays or in cubes is you're going to steam this. You're going to put a lot of pressurized steam into it. It's going to get really wet, and you're going to squeeze it through a die. In that process, we're going to lose that calcium carbonate. Calcium carbonate is very water soluble. It's going to move right out. So again, when they've done the studies, they were feeding an alfalfa hay. Mm-hmm. And one of the things I've always wished they'd done is look at, okay, well, let's get a sample of this hay, how much calcium carbonate's in it. The studies have been all off using a hay. The pellets and the cubes, they're not going to be as high in that calcium carbonate as the hays. Plus, especially the pellets, they're going to have a much higher passage rate out of that stomach because they're already broken down. Yeah. They're going to have a higher passage rate. You're not going to get that slower time release. So again, there's not really a study out there on it, but you're going to be better off feeding alfalfa hay than a pellet or cube. They're not the same.
Good deal. Well, does anyone else have any other questions? We are creeping up on that 7 o'clock mark. Anybody else have any questions? Feel free to type it in the chat box or unmute. All right. Well, if there are no questions. If you think of anything after this presentation, please don't hesitate to email me. You can email me at abest22@uga.edu. And thank you again, Dr. Carter, for speaking to us on this. There's a lot of research, a lot of science behind these methods that he's talked about. And hopefully we can improve the quality of life of performance horses. And I know, being an owner of a performance horse, I definitely need to be concerned about gastric ulcers moving forward. And so, all right, well, everyone have a great night, and thank you again, and happy holidays.
Thank y'all for having me.